Um, Good evening, everyone. This is Jamila from Friends of Cancer Patients. Pink Caravan will present today in collaboration with University of Sharjah an awareness lecture about urinary incontinence in women, preventive strategies and management, presented by Dr. Menisara, lecturer in nursing department, and Dr. Veena, lecturer in physiotherapy department in College of Health and Science. So, dear attendees, I would like to notify you that the questions will be typed in the chat box and it will be answered accordingly once we will finish the session. And during, inshallah, the session, I will be sharing the link for the certificate. So, you will get your certificates through your mail. So, good evening, Miss Minnie. Thank you so much that today you and Dr. Venus here with us. Over to you. Shukran.
Go ahead. Hi, good evening, everyone. Thank you very much, Jamila, for the introduction, and thank you very much for taking us over and making us being a part of this great event. And it's really a wonderful move from your side to do such a wonderful activity for the women. It's really wonderful. And today, the topic that we both will be presenting to you is about urinary incontinence in women, certain preventive strategies and management. Well, we all know very much how much of stigma is attached to this particular urinary incontinence. And anybody who has it always tries to act as if, no, I don't have it. Or you do all the ways to just feel and, to want to just show that you are fine. You don't have such an issue. But we know that incontinence is such a huge problem, and it is really a hazard. It's really a healthcare problem. Now, today during this discussion, sorry, yeah, but by the end of this particular presentation, we both desired that you will be able to understand what is the incontinence, will be able to recognize the significance of the problem, appreciate the incidence of incontinence among the population. You'll be able to identify the effects of the problem on individuals, explore the risk factors for incontinence, identify types of incontinence and their cause, evaluate their quality of life with incontinence, and explore different treatment options, including conservative and surgical management. So let's begin. So this picture, it's it just talks everything to us what incontinence is. It is an involuntary loss and escape of urine. You do not want to feel, even if you try so much, that you become wet, and you don't want to tell anybody that you became wet. Now, looking at the geographical distribution, if you say which part of the world is not affected, everybody in any part of the world you look, whether it's America or it's Africa, whether it's Europe or it's Asia, everyone is so much affected. This itself speaks to us how significant this issue is. If you look at the complete population of the world, even where you looked at, when you look at the population, we are actually looking at people about 20 plus, because they are the ones that we're talking about and not the children. And you can see that the women are more affected than the men, around 303 million, and compared to the men who are about 121 million. So you can see that it is more, though it is there in men, still the significance is more in case of the women. Now, this particular graph would also speak to you about how it increases as we age. We can see that the incidence of urinary incontinence is also increasing. So obviously, the elderly people, many of them are affected, and many of them, believe me, they don't speak about it at all. They think that, oh, as we age, these things do happen. and we have to live with it. There are very, very few people who will actually do something for it. So looking at how it is affecting, you could see that there is a lot of sense of law, there is a loss of control. It's not be in one's own capacity. The person feels so incapacitated. The person feels that I'm done. This has happened to me. It's a really, depressing. The person feels very much ashamed. Very often, they even have the odor of urine because of this incontinence. So this makes them feel ashamed. They don't want to go into parties. They try to isolate themselves. Even their sexual life is affected, and very often some of them become depressed. And about 50 percentage do not seek help. They just try to just comfort themselves and just take it that this is a part of life. And how many people, if you will see, about 50, as I just told you, 50 percentage do not take any treatment. Why they don't take treatment is because they think that this is it, and they need to accept it. And they have certain misbeliefs. There is unawareness that there's so many treatments available. They do not know that something can be done about it. Sometimes they don't even take treatment because they feel that it is something shameful, and maybe people shouldn't know about it. So there are a lot of treatments which can cure them, and they really don't know about them. Now, as I was just telling you, that it affects them so much mentally and physically and all. Even their day-to-day activities affected. The prayer, the prayer that they have to do. There are so many of them who are affected because the different positions that they need to take while praying. This has been affected. Some of them they will start become incontinent the moment they take certain positions. And certain religion, they feel that they are unclean, and how can they pray? This is also a situation. And as I told you, the sexual relationship is affected. They try to avoid and make excuses. Physical activity, obviously, it is affected, and even the social activity, as I just told you. This is based on a study which was done in UAE in 2013. There are various risk factors. So, as I told you, as we age, the probability of getting incontinence is very high. Obesity, this is very, very common, and you can see that this could be a very big risk factor. And the multiple pregnancies that a woman has, this could be also another reason for incontinence. Some of the women who undergo hysterectomy, they also have a probability of becoming incontinent. Certain ethical races also have it. Mobility is another issue. If those who are immobile and not having too much of activities, they do have. Diabetes make them prone to it. Dementia, menopause, and those women who are on replacement therapy, we will talk, some of them are on estrogen, which could be another reason that they are becoming incontinent. Certain lower urinary tract symptoms and infections could be also risk factors, and all other comorbidities. And there are some factors which actually are within our control. They are modifiable, like, for example, taking of alcohol, which is not very common here, but there are people who are having consuming it, which could be making them very much prone to this incontinence. Smoking, drinking of coffee, tea, and colas are also making many of the people susceptible to urinary incontinence. Lack of exercise, like ending up into obesity, could be another factor. Now, let us just try to learn about a little more about what is the incontinence. When we look at the anatomy, the normal bladder, we can see that there is a muscle which is controlling the urine. It undergoes contraction, and that's what helps the urine to be excreted. They are the detrusor muscles. As you can see, there is a ureter which brings the urine into the bladder. You can see that there are certain sphincters which control the passage of urine. So the sphincters should be tight enough, and if there is an issue with these, whether it's the muscle or with the sphincters or with the urethra itself through which the urine passes, all these things can cause incontinence. So now, if you look at what are the different types of incontinence, we can just understand with this simple picture, which you can see. They are named in different ways, and we will be just going through them very soon in the coming slides. So, like the stress incontinence, which is the first one we can see. So, basically, it's because of increase in abdominal pressure. Or the second one, it would be called as urgency incontinence, or urge incontinence. It's also called so. It can, the third one is the mixed incontinence and overflow incontinence. It's something like, the most prevalent one is the stress incontinence. So let us see what is the stress urinary incontinence. As you can see, in the normal anatomy I just told you, that the sphincters have a role to play. The muscles have a role to play. So the sphincter is relaxed and it's open and it's allowing the urine to just flow out. The pelvic floor muscles are also become very weak because of different reasons. So what happens is that this lady who is coughing, or a lady, when you are sneezing, or you are doing weightlifting exercise, the lady becomes incontinent. Okay, there is an involuntary leak of the urine, even though you did not feel like passing urine. It just, you had an accident. It is mainly because of increased abdominal pressure. There are other reasons for this stress urinary incontinence, like multiple pregnancy, having twins, triplets, or quadruplets, whatever it is. This could again make the muscles to become weak, the ligaments which are helping to prevent this from happening. All of them becomes weak. So that could be one of the factors. And difficult delivery. Obviously, there are some deliveries which become difficult, and the healthcare people, we may use certain forceps or a vacuum, or so yeah, like, it can cause a lot of injuries, and that could be another reason. Or putting on a lot of weight during pregnancy could be another reason. So basically what happens is that there is a pressure being exerted, and that could be the reason for the incontinence. So previous incontinence will make it even more worse when the lady becomes pregnant. Having multiple pregnancies, and her twin, all the previous pregnancies also you had a incontinence, then the possibilities for getting another incontinence is very high. Yes. Also, there is another reason, that sometimes the baby which is born is quite big. So all the more it makes the delivery difficult, and making the chance for urinary incontinence high. A weight more than 4 kgs is enough to make a person prone for urinary incontinence. The next type would be the urge incontinence. So, urge incontinence, the moment you feel like you have to go, you have to run, or you are going to have an accident. Okay, so urge incontinence means an involuntary leaking. It is associated with a sudden strong need to void. And if you did not find a toilet, then it's finished. So, it's usually because of certain infection or maybe certain neurological disorders. That's why I was telling you that it's so important to increase the awareness of people. It's not, there are certain incontinence which can be treated, and you can avoid this sort of situation of incontinence. So unstable bladder, or involuntary muscles of the bladder which is contracting, or the bladder becoming very sensitive because of some infections, could be the reasons for this particular urge incontinence. The urine is lost without any warning. This is the condition. So the incidence is usually increasing, especially among the women who are in the menopausal age. So, and also it could happen in case of certain diseases like Parkinson's disease, or maybe some other urinary tract infection, or some bladder diseases like you have a stone or a polyp. That could be the reason. So obviously that is treatable. Then there could be some certain triggering factors. For example, just hearing the water running, like somebody opens the tap, and the control is gone. The person may just have an accident, may pass the urine. So this is what is urinary incontinence. Now, the third one, which is very common, is overflow urinary incontinence. This is another situation. So overflow means there is some amount of urine which remained in the urine, and so anything adding on to it, again it will just flow. So this is overflow incontinence. It occurs when you are unable to completely empty your bladder. So that means always there is some residue of urine remaining in the bladder. So if the residue is there, for example, a residue of about 500 ml remains inside the bladder, so that means what happened is that even any little bit of urine again forming, it is just going to overflow. So before the lady even reaches the toilet, she is wet. So this is what is overflow urinary incontinence. So usually this is also very much treatable. It's you should not just take it that it's a part of life. No, it could be just because there is a blockage in the urethra. Maybe there's a tumor growing and it's pressing onto the urethra and preventing the bladder from emptying fully. So it could be a stone which is there, a urinary stone, or maybe a previous scar tissue which is there, or there is a swelling from an infection which is blocking the passage of from the urethra, or maybe there is a bend, like a kink which is there. So all these things are treatable, and we need to really increase the awareness among the public that they shouldn't take things granted. Certain neurological diseases like multiple sclerosis could be also a reason, where the bladder becomes very weak and there is inability to squeeze the bladder completely and be free of the residual urine. Also, there are some drugs which you can see, like the commonly certain drugs like estrogen, I was just telling you. Maybe it is taken during the menopause, which could be a reason, or it may be already you are on a diuretic, which that means the person will be, the diuretic will make the urine. So already the person is taking a medication for the urine to be excreted, more amount of fluid to be removed from the body. So that could be a reason. Or you may be on certain other drugs like a calcium channel blockers or alpha blockers. So these drugs could be also. So unless you go to the doctor and you check yourself, you will not know why you are incontinent. Maybe these drugs need to be changed with something else that could solve your problem. So this is what is overflow urinary incontinence. So then another one, that is mixed urinary incontinence. It's a combination of overflow incontinence and urge incontinence, both of them in the same person. And we know why overflow and why urge incontinence happens. Usually this happens post, the residual volume is about 150 ml, or maybe because of disease which I just told you, multiple sclerosis, or maybe because of the aging, or maybe obesity, or a chronic constipation itself which is blocking the urethra, could be, and intense physical activity. These could be the different causes causing these particular problems. So I hope I have shed light into some of the aspects. My colleague will now speak to you about the management. Thank you.
Assalamu alaikum. Thank you so much, Jamila, for your kind invitation. Really, it was a pleasure, and it is a pleasure to have you all join us on a Thursday afternoon. Thank you so much. So what we are going to go ahead with is going to continue on and look at history, a little bit of assessment, and then move on to treatment. So with history, with regards to history, if you were going to go to a specialist or to someone, the first thing they do is ask you, take a history from you. They would ask you about the onset, the duration, the severity, what activities sort of make this better, make it worse. And from that, they would ascertain what the cause is. Is it stress incontinence, like she said, due to increase in intra-abdominal pressure? Is it urgency, which is due to a hypersensitive bladder? Is it urge incontinence to void but related to an overactive bladder? Or does the bladder not empty? So that would they would ascertain. Furthermore, what they might ask you to do is fill something that looks like this. Now, you may have seen a food diary, what you eat, what you drink, you sort of report it. If you're on a diet, you're frequently asked, okay, write everything, write how much you drink, write what you eat. A very similar kind of diary is filled, and this is called as a bladder diary, or even as simply called as a frequency volume chart. And they want to see how much is what is the intake, how much is the filling capacity, and how much are the number of pads used if people use pads to control this incontinence. Normal output should be about 1 to 3 liters every 24 hours. Okay. Furthermore, you might continue, and you might have to undergo a digital palpation. And now, earlier on, this is frankly one of the reasons why it is underdiagnosed and undertreated, because many midwives, many nurses, many physiotherapists are still not trained well in digital palpation, and it usually forms the part of very intensive postgraduate courses. But possibly it's gaining more and more awareness and attention to be brought in to somewhat an earlier level, just so that it can be done, because it has very high inter-rater reliability. So if I was going to do it and Miss Minnie was supposed, if both of us did it, our inter-rater reliability as to how much or the grade of the pelvic floor or how strong the contraction was would be very similar. So it's a very great way to assess the pelvic floor. Also, as you can see, we are assessing the muscles of the pelvic floor as well. You can see very clearly that you have the uterus for sure, but very close to the uterus is the bladder and the rectum. So all these at the bottom form like are controlled or are sort of surrounded by fascia, which is the pelvic diaphragm, and a lot of ligaments which kind of keep it continent and hold it in place. So that is something. If needed, you might be recommended for further investigations, not the PAT test, but this is an example of a uroflowmetry, and you would be asked to void in privacy, of course, and then the flow that is happening would be recorded with urodynamic equipment. This could be while you're walking, this could be by video, variety of ways this could be done. This is just one example. They might call you in and give you something colored to drink and then take visual images, even go ahead and look at an MRI. That's something that might be done. You might have to undergo a sensory assessment to make sure that there is no neurological cause to the incontinence. So you might have a lot of assessments done in this manner. Some of these questions could be personal. However, the answering them truthfully is really important. And again, as she mentioned, it is underreported and underdiagnosed. Only 1 in every 4 women actually reports incontinence, which is really 25% only. And part of these awareness seminars and why we both got so interested is because as healthcare professionals, one of our main role, first step is to raise awareness, and then it's step 2. It's about 3 months ago. A faculty member from another department who recently delivered a baby, not recently, 8 months, 9 months ago, delivered a baby and is about 45, was casually talking to me. And she said, I asked her how you're feeling, everything. She said, yeah, everything's good, but I have some leakage, but it's normal at this age. She's a healthcare personnel, but from a different department. And I told her, no, it's not normal. There is a lot you can do. And we went into further discussion, and she lost weight. She had lifestyle management. She controlled her diet. She controlled her the way she was doing things. Kept a bladder diary. Kept a schedule of voiding. So sometimes, if we know we have these, we have a schedule. Like, I'm sure you all use the restroom before you sleep at night. Why? Because we don't want to get woken up to go. Something similar. So you can have like a schedule, avoiding schedule. So there are a lot of strategies that can be used. This is just one of them. Now, strategies used to manage incontinence vary widely, okay, with people using pads, protective garments, a small percentage to pelvic floor exercises, a small percentage limit fluid intake, and this causes dehydration. You might hear some people telling you, no, no, I will not drink before going in for the movie. Or before going in for an exam because I'll want to go to the washroom. So um, uh, that's a huge number. And also 15% wear darker clothes or modify their wardrobe because they want to hide accidents. All of these are frankly not acceptable because there is treatment available, and we have to get over the stigma and go and seek help because there is help available. Okay, so let's see what sort of help is available and what we can do. um, this simple picture is again showing you the same palpation, but from palpation we can find out what is the strength of the pelvic floor. Okay, and based on the strength, so for example, the strength could be that there is no contraction of the pelvic floor, there is a flicker, meaning very small contraction, a weak contraction, a moderate contraction, a good contraction. So when you contract the pelvic floor, you should feel like a lift. You should not feel just a contraction, but a lift. So that contraction and lift combination is very important, a grade 4 and strong grade 5. Now, when we are children, we are told to strengthen all our muscles. We are told, oh, do abdominal, do back, do whatever, your arms, legs. Did anyone ever tell you exercise your pelvic floor as a child, or as an adolescent, or as a teenager, or as a pregnant woman? I'm sure no. And this is the challenge, and this is where we all should intervene. And if you are not a healthcare provider, this is where you should educate your mom, sister, aunt, whoever. Okay, it's your job, if you attended us today, to do that. So what are the options to be managed? Now, if I have someone with a very low grade, like if they have like only a grade 0 to 2, meaning they are really, and you can see on the right side the scale, if they are quite weak, then I might want to go ahead and use electrical stimulation. I might want to use manual pressure and biofeedback. I will discuss some of this as we come. You can see something that is not there in the others, and I want to caution you against, or I want to tell you a little bit about the use of Kegels. Okay, Kegels is not for everyone, and it's not a one size fits all description, and some people over prescribe Kegels. Why? Because Kegels exercises, and I'm sure some of you have heard of these are exercises for the pelvic floor. I'll tell you how to do them. But they are done when you have a weak bladder. But sometimes incontinence is not only a weak bladder. Incontinence can also, I mean, the muscles are not always weak. Sometimes the muscles are in spasm, spastic, hypertonic, not always weak. So it is very important to get a thorough evaluation done before exercises are prescribed. So it is important to evaluate before you just prescribe Kegels to anyone or pelvic floor exercises to anyone, but I will show you what the options are. So those are options. When you go on and they are a bit more moderate, they can still do the electrical stimulation, biofeedback cones, and add some pelvic floor muscle training. And when they are stronger, then they can add in what is called as core stability. Core stability is another complete lecture and or a talk. Kegels is a muscle exercise. That's very correct. It's a pelvic floor muscles exercise. Pelvic floor muscles are these muscles at the bottom which control or maintain your continence or hold the sphincters well. And they need to do both. They need to contract, okay. Also, they need to relax when you need to void. So they can't only contract, they need to do both, okay. Before we do any exercises, our first role is patient education. Awareness education is important. This seminar is an example. Progression, it's important to do a regular evaluation, and we will discuss some treatment options, both conservative and surgical. and some motivational strategies. Remember, motivation is very important, and if someone reports it to you, you have to motivate them to seek help, and you have to motivate them to make sure that they can get some form of improvement. Okay, let's look at electrical stimulation first, and I will show you some examples. Yes, you can, but like I said, you can. Wafa has a question. She's saying, "Can we do Kegels?" Yes, possibly, but it's like I said, it's important to have a thorough eval, and then you can get it done. I've put a link here, a YouTube video link, which you can watch later. This is an example of a home stimulator. It's a very simple machine, a small machine. You can have it at home, and is really effective for strengthening the pelvic floor. You can see the electrode inserted, okay, vaginally, and these parameters that you see are possibly will be taught to you by your physiotherapists, or can be self-taught as well. In both cases, no problem, they can be self-taught. And these metal bars that you see, very safe to use, very tolerable current, and it just will get you to contract and relax, and will provide stimulation of these pelvic floor muscles. Then if you have a particular topic, or if you have a particular question, you can email us, and we can give you more information on where to source these devices, how to get them, how to do these exercises, etc. So this is a called as an electrical stimulator, and this uses what are called as vaginal electrodes. These electrodes are inserted with gel lubricant, so and they look bigger in the image. They are not as big as they look, and you can see a little machine. This machine can be just put on the side, or on your belt, and we can use it. Okay, then how long should this be? And you can see that here she's having a trial in the clinic, and this particular vaginal electrode is not only is giving her electrical stimulation, but is giving her biofeedback. She can see on the screen the how much is the contraction. She can see on the screen how much is the intensity of the contractions. Very similar to a CTG that you have, where you can see the frequency of contractions if someone is in labor. Similarly, in this kind of setup, biofeedback setup, you can see the contraction and how much how strong the contraction is, and you can tell the woman, come on, stronger, stronger, and they can get feedback this way. How long should you do it? You can do it about 20 to 30 minutes, and you can do it twice a day, and it helps. That's biofeedback. However, there might be some precautions. Again, it should be done only with initial sessions should be done with someone who is trained. You could look for a women's health physio, even some gynecologists could be trained in it. But if you have any altered vaginal sensation, and if there are other conditions like epilepsy, they should be worry, and you should apply it only following consultation. One of the most important things to be included in this is definitely weight loss, and controlling smoking intake, caffeine intake, modification of sport. Now, sometimes we tell these women, avoid your jumping, bouncing movements in the initial phase, because you don't want, let's say there is prolapse or there is stress incontinence, you don't want to further aggravate it. So for some time, they are asked to do sports modification until they can strengthen their pelvic floor, so that they can get back to activity. Okay. You'll ask me, why should I make my pelvic floor strong? And you can again watch this video of how you can do these exercises. But a strong pelvic floor can treat the leaking, which is stress urinary incontinence. If you make your pelvic floor strong, it can also help you control the sudden urge to urinate, unexpected stool leakage, because when you do pelvic floor exercises and the Kegels that I will show you, you normally talk about contracting both passages, the anal passage as well as the vagina. So you contract both passages, not only one opening. Okay. So that really helps. Okay. So benefits, benefits, especially if you are pregnant, if you are early menopausal, it can really help. Okay, in both cases. It can, even in males, it's valuable, and they can do the rectal one. And it helps to ease prostate problems and restore erectile function. So while we are talking about women's health, another very important or interesting domain, maybe for a future seminar, is men's health. um, Equally and more important. Okay. Now, how do we imagine these muscles? Very hard to explain, but I think you can all imagine how you can imagine where these muscles are and how you can find these muscles. Normally, we use some of these guides or prompts, and we tell them, imagine that you are sitting on a marble. Now pretend that you pick up that marble with your vagina, like it's just pretend that there is a marble, and suck it into your vagina, or insert a clean finger into your vagina, squeeze your muscles as if you were holding urine. Stop urinating and try and hold. Sometimes we can use something that looks like these, and I have shown you this is a vaginal cone, and I'm sure you can see it, of course, inserted with lubricant, personal to a woman, not shared between women, not very expensive at all, very cheap, easily available. And this can be inserted into the vagina so that they get a feel of what it is. So you just insert that like a tampon and squeeze, and that will, it's very important to show someone, because when you show someone, they know what is to be done. So what is the sequence of doing Kegels exercises? And usually you tell them, okay, squeeze as if to stop. So it's done in series of steps. Step one, you can tell them, okay, squeeze as if to stop the passage of gas or stool. Usually with the rectal opening. Hold 1, 2, 3, 4 and relax. Make sure you're not squeezing your buttocks, you're not holding your breath, you're not contracting your stomach, abdominal muscles, you're not contracting your thighs. You have to make sure the contraction is from the bottom, deep. Okay. That's the first step. Now, again, having said that, you must know that we have on the pelvic floor two types of fibers. One type of fiber which requires that you contract, hold. Okay. Second type of fibers requires you to contract, relax, contract, relax, contract, relax. So for example, let's say you're in the washroom and somebody knocks the door, you are able to immediately stop your flow of urine. This shows you that this pelvic floor muscle has what are called as fast fibers. They work fast. And it has the slow fibers which work slowly, like as if regularly when you are trying to prevent to go. Okay. Absolutely. A pelvic floor exercise can strengthen muscles, support organs, and can help you control your incontinence. So, sample Kegels exercise. The first thing you need to do is empty your bladder. You can all do these at home, no problem. You have to make sure that the bladder is empty. One common mistake is bladder is full. While you do Kegels, you can't do it. Locate the correct muscles. Now, I showed you the different ways you could use it. You could use these. You could tell someone, imagine as if I am in the hospital and we explain it to a patient, we tell the patient, think like you are stopping the passage of gas, contract your back opening, close your back opening, or think that you are stopping the flow of urine. So first we do the back opening, then we do the front opening, and then we do both together. And if I'm there, then I make sure that they don't do any abdominal, they don't do any buttock squeezing, or they don't do any thighs. That is really important to get the correct muscle. Next question you will ask me, which position I should do it in. Always best to start from what we call as crook lying, meaning lying relaxed, bending your hips and knees, because you are comfortable and relaxed. But you can even do it sitting. Right now I'm sitting, you can do it. And the fact that you do a contraction, nobody can see you do it, right? So even sitting at work, you can or wherever you are sitting, looking after a baby, whatever you are doing sitting, you can, listening to me, you can still do that same pelvic floor contractions. You squeeze for 5 to 6 seconds, relax for 5 to 6 seconds, and you can do 10 to 15 repetitions at least 3 times a day. Does it help? Absolutely. Does it improve? Absolutely. Okay. Absolutely improves. Um, this is the other one. Now I showed you just one, but we have a set of, I can show you my little ring, and they come with jelly. Now you can't see them. This is a set that a woman will have, and it has numbers on it. And it has numbers from 1 until 6, with 1 being, like if I show you one, this is 1. You can't see a difference in the size, and this is number 5, the heaviest. But if you hold them in weight, and if I was to compare these two in weight, there is a difference of milligrams. It's not, how expensive are these are only about 200 to 50 dirhams. In fact, I know we were even getting them for about 180 180 dirhams. They can be inserted with simple KY jelly, worn throughout the day, doing all activities. No one even knows that you are wearing them. Do they help? Absolutely, very well. Okay. Only contraindications are, you should just be careful. They should be clean, like how we would sterilize something. You need to wash them in warm water. You don't need to boil them, but you need to wash them, keep them clean, store them in the container. Regular precautions. Okay. So that is something to consider. The other device you can use is something called biofeedback. Again, we call this to be perineometer, and I will show you the device and the tubing. Again, very simple device. You get fancy devices which are digital, but this is a very simple manual device. I will show you what is done to it and how it's attached. So, for example, if this is like a sensor, okay, inserted vaginally. And so, okay, this is the setup of the unit. Okay, so this is the setup of the unit. Okay, this tubing is coming down, and this is inserted into the vagina with KY jelly. And you can see that it has a little bit, it has a gauge. Okay, it has a gauge, and you can see when it is done, the gauge is moving. So you can see me press upon that, and the gauge is moving. I also have a little red knob to adjust the resistance, to make it no resistance, so it's very free, the movement, and then make the movement a little bit hard so that it is more hard, or giving you more resistance. So this is something the woman, if she has her own, she inserts this vaginally, she can contract and look herself at the reading she is getting. This is referred to as just a digital. This doesn't have a digital gauge, but you can get a digital one on the right side, which is a little more expensive, but digital biofeedback, okay, or manometric biofeedback. We can also do EMG biofeedback, but that again has machines, and it becomes quite costly. Where do we get this? We can order, you can order, and there are a lot of available suppliers even in the UAE. We can direct you to some if you're interested. Okay, other than this, what else should we do? Sometimes drug therapy is needed, bladder training is needed. And I spoke to you about bladder training. Bladder training is maintaining a voiding schedule, maintaining, controlling your diet. If you know it's an issue, then you drink accordingly, you eat accordingly. So that some people advocate hypnotherapy or acupuncture, few limited studies, but still it is worthy to mention that hypnotherapy, acupuncture. Now, I would advocate relaxation, serious relaxation, especially for a hypertonic bladder. And you must have felt this. If you're nervous about something, anxious about something, you will tighten everything, including your pelvic floor. And someone who has an anxious personality faces the opposite problem. Not a weak pelvic floor, but they find a pelvic floor which is too tight and unable to relax. even that is an issue. So the evaluation will show you, are you the one who, because of childbirth, whatever, have stress incontinence and you have a weak pelvic floor, or are you on the other end of the spectrum where you have a very tense pelvic floor? So when you have a tense pelvic floor, of course, you need relaxation. So meditation, relaxation really helps. And if you have a weak pelvic floor or a loose pelvic floor or a lax pelvic floor, then whatever I showed you just now, all those cones, all those strengthening, all the exerciser really helps. Now, usually who has a weak pelvic floor? Usually big babies, pregnancy issues, post-pregnancy, post-delivery. You saw some of the risk factors. Okay. These are some other options. I know we are almost close to time. I want to give you all 5-7 minutes for questions. These are alternative devices like prosthetic devices, intraurethral plugs, tampons, pessaries that could be used if needed. And if there were some prolapse, if it was due to a prolapse, these could be used. Medications also, but the aim of this class was, or this lecture was, to do mainly conservative options. But I wouldn't complete it without telling you that if none of these work, there are a lot of surgical interventions possible, obviously, and they could include like suspensions, what are called as retropubic suspension. So if you have weakness due to anatomical issues, this anatomy, you could sling, you could attach what is called as tension-free vaginal tape, TVT, and pull that up. So, or transvaginal suspension. So there are some slings or mesh procedures where meshes are put in order to do this. Sometimes artificial urinary sphincters might also be used if there is an inactive sphincter. Okay. Other than that, exercises such as yoga and other regular aerobic exercises, regular walking, in order to make sure that you have your obesity in check, of course, are really important. So having said that, we would like to share our references with you. And I hope you enjoyed it. And we were so pleased to have so many of you with us on board. And I hope you can, we both hope you can at least provide 2%, 3%, 5%, 10% of what you've learned today or heard today to someone else, inshallah. So thank you so much. And now we both are available if you have any questions from either of us. So you can please chat, put them in.
Thank you so much, Dr. Minisara, for such an informative presentation. Thank you so much, Dr. Veena, for such a preventive management techniques. We would like to request our attendees, if they have any questions, they can type it in chat box, and the both doctors, they will answer accordingly. Dr. Veena, you can unmute yourself. I think Rajini, she's asking a question.
Sorry, Rajni. The digital gadget is available in the pharmacy. So the cones are easily available in the pharmacy, Rajni. Life pharmacy, usually we used to use them in Latifa. So the Arabian Home opposite Rashid Hospital used to have them. Not that I'm advocating any supplier, but we have some online suppliers where they could deliver it to you as well. Health Mart, Physio Mart are some. But even nowadays, if you order them online on Amazon, or really easy. Thank you, Serena. Someone asked us a question privately, and I think we will answer that privately on the chat. Okay, any other questions from the whole audience to any of us? Okay, thank you so much, all of you.
Thank you so much, Dr. Miss Mini Sara and Dr. Vina for such an informative and illustrative presentation. I would like to remind the attendees that the link for the certificate I have shared in the chat box. So they will be, inshallah, getting their certificates at the earliest. Thank you so much once again. Thank you.
Thank you so much, dear Jamila, and we look forward to doing many more such informative events, inshallah, for all of you. Shukran.
Sure. Thank
Sure,
you.
inshallah, sure, very soon. Thank you so much.
I'm sure Miss Mini, Dr. Mini misses you as much as you miss her. I'm sure. I can see all your nice chats.
Thank you so much. Miss you all.
Yeah, equally and more.
Yeah.
We miss all the students who leave us. Yeah, they don't leave us. They go to make the world better. Yeah.
Yes.
So thank you so much,
Thank
everyone.
you so much.
Thank you. Thank you. Thank you for the audience. See you.